Well, unfortunately, it has become more and more that you hear about someone accidentally overdosing from prescription painkillers. Well, our next guest says they're so accessible and so addictive, it has become an epidemic in this country. We hear about it in the news all the time. Joining me now is Dr. Paul Lynch from Arizona Pain Specialist, and he's here to talk about how you can avoid the risks of overdosing and addiction, and also tell us about some alternative treatments and options for chronic pain. And welcome back to Sonoran Living Live. We appreciate you being here.
Thanks for having me.
Tell us about how bad is this problem in society?
You know, it's become what we call an epidemic, and I think that's the correct word for it, where it's happening all around the country. It's kind of out of control. If you look at the statistics, one person dies every 19 minutes from prescription medication, and I think to me, I was telling you earlier, this is the single most important topic for my career. I feel like if we have a calling in life, mine is in the healthcare space to try to warn the public about the risk of pain medications, and not just pain medications, but anxiety medications, sleeping pills, muscle relaxants, pain pills. A lot of these medications have really good uses when used properly, but when you combine them together and you take them over years, there's a lot of really bad things as well.
I'm curious, and I don't mean to put you on the spot, but have you been touched by this personally?
Well, I'm touched by it every day with the patients in my clinic, the stories I see, the people that we try to help. And, you know, many patients really need to be on pain medicine. You know, I have patients in my clinic that fought in Iraq and have come back in wheelchairs and have been shot, and you want to help them. But then what you see is there's a slippery slope where the medications that are intended for good and really good doctors who are trying to make a difference, and then the patient actually has a bad outcome. And sometimes that bad outcome can be death. And that's where it gets really scary, and we try to talk to the patients about the risk of death, and it's way higher than we ever realized. If you look at the statistics today, there's about 8 million Americans who take pain pills every day.
Oh
but
my
if you,
gosh.
It's out of control. 8 million Americans will take pain pills, but the death numbers are about 16,000. Now, if you do the numbers, that's about 1 in 500 people who take pain pills will die. And it's not always the person who's actually taking the prescription. Sometimes it's a family member or someone who gets a hold of the pills, or a kid who goes to school and gets it from a friend. But we'll say it this way: for every person who's taking pain pills, 1 out of every 500, there's a death associated with that.
That is staggering, and you know, and it's so unnecessary. So, and I know, I sense your passion, and I hope our viewers at home do as well, because I mean, I just can't tell you how I can sense how important this is to you and this messaging. So tell us, you're with Arizona Pain Specialist. So how do you manage pain? How can you help patients realize that they don't really need these pain prescriptions?
Well, you know, what we did, Dr. Tori McJunkin and I started the practice about 5 years ago. And one of the things we said in the beginning was, even if we're the 2 least busy pain doctors in the Phoenix area, we're just not going to make pain pills a big part of our practice. And so what we did is we set up a program where we could actually get patients off of pain pills and give them other alternatives. So we do things like chiropractic care, physiotherapy on site. We have behavioral therapists that work with patients. We do support groups to talk to them about it. And then we have really advanced life-changing procedures that we do as well. We do PRP injections now, where we take patients' blood and we spin it down and we can inject it near injuries. We do all kinds of kind of life-changing treatments. And so we give patients options. We don't just say, oh, you can't have those pills, but we show them a plan to come off. And most patients who come to see us, over 50% of the patients referred to us on pain pills come completely off within 90 days.
90 days?
Yeah.
Wow, that is pretty impressive. And you know what I'm sensing from you is that you are partnering with your patients and working alongside them, and it sounds like it's a comprehensive long-term plan.
It is, and we've also designed some really industry-changing measures. We started something called the 12-Step Opioid Prescribing Guide that we're working on publishing right now, and that you can download on our website on ArizonaPain.com. But we basically talk about, if a patient's going to be on pain pills, then these are the 12 steps we take every month to ensure that it's safe, and we think it's really an industry-leading measure. We're using it in 11 states now.
Wow. Well, Dr. Lynch, thank you very much for sharing your passion and your philosophy and how you are treating pain in a helpful, natural way with your patients. So if you need more information, Arizona Pain Specialists, there's the address right there on your screen. They're located in Scottsdale. The phone number is 480-563-6400, and more information can be found at arizonapain.com. And there's also a Glendale clinic, if that one might be closer for you. The address right there is on 79th Avenue, Suite D101. And again, there's also one in Chandler. There's one for each store or each location up there. The Chandler location is at 655 South Dobson. And as we mentioned before, their website as well. And of course, we always put all of this information up on our website, sonoranliving.com. Dr. Lynch, thank you very much for being here.